for about 10 plus years, like you said, I was misdiagnosed. They thought at first was severe depression, then they thought, oh, bipolar. Then they thought, okay, bipolar 2. And then, so the difference between bipolar and borderline, because they're very similar, and it's hard to really, I compare it to, because they're very close and the same. Bipolar is more like this, and borderline is just your environment. So Marsha Linehan said, she was quoted saying once, borderline patients, just think of somebody that's been burned on 90% of their body. That's how we feel emotionally all the time, and that's why we need DBT to regulate our emotions, because our emotions are so intense. Like I was explaining earlier, like if somebody doesn't text back right away, I think, oh, they hate me and I'm a horrible person, I'm a horrible friend, I don't need to be loved. And it's like, somebody that doesn't have that would think logically, like it makes sense now because I'm not having those feelings at this moment. But in that moment, a logical person would be like, oh, well, they're probably busy, or they're sleeping, or their phone's off. I think that, but borderline, we kind of like think that, and then we automatically just, that's not true. That's, we just think all these paranoid thoughts and lies that aren't true. So that's probably the biggest difference with bipolar. Now, I have had manic episodes with which that's part of bipolar. Borderline, you can have what they call a split from reality. So there's a little bit of that. Medications usually don't help with borderline patients. When I was in the hospital in December, my doctor said, you can take your meds. It doesn't look like they're helping, because I had a big split from reality. I was just thinking all these paranoid thoughts, and so that's why I had to go into the hospital, and unfortunately, so I've been off my meds since December, and I know I'm not saying that meds won't help stabilize, but there's been studies saying that DBT is what, cognitive behavior therapy as well, is what really helps borderline patients. So.